Colorectal cancer is the second leading cause of cancer globally regarding cancer deaths, and in frequency it is the third most frequent cancer globally. It is a cancer where the treatment is surgery, and we know that preventing the cancer is something that is of great importance. So preventing cancer will be, for example, to remove precursors to cancer. So these adenomas, these are beginning cancers, but they have not been a cancer yet. Colorectal cancer is usually a disease of the middle age, so the median age is around 65, 70 years. But we see a tremendous increase in the younger patients with rectal cancer. So in the next 5 to 10 years, we will see that every fifth of our patients will have cancer in their rectum below the 50 years threshold. So every fifth new patient that we have with rectal cancer will be less than 50 years old. This is a worrying development. Globally, we see this both in the US, UK, in the European countries. So we need to be better in inventing ways to how to prevent the cancers from developing, but also how to understand why these cancers are developing, especially the younger patients. And here again, the microbiota is a central part of the disease mechanisms as we know it right now. We don't know it quite yet, but there are some strong indications. So there are different challenges. If you have a precursor of a cancer, such as an adenoma, we remove it by endoscopy, we remove it, but these patients usually get another adenoma, which can then develop to cancer. So the challenge is, can we do something when we remove the adenoma and then prevent a new adenoma or a cancer from occurring? And this is the innovative approach that we're using in this area, where we are attacking one of the key drivers for adenoma creation, which is this bacterial biofilm lining the inside of the bowel. So by treating the inside of the bowel with fosfomycin and metronidazole, we can change the microbial constitution and then push towards a less of a risk for developing an adenoma. And this is supported by our initial results, that we actually can show that we both push the immune system to being better in removing the precursor cells to the cancer, and that we also change the microbiota in order for it to be less stimulating towards developing to a cancer. So in this collaboration with Reponex Pharmaceuticals, we are examining the impact of a combination antibiotic, fosfomycin and metronidazole, for microbial modulation, both in patients with precursors of cancer, so adenomas in the right side of the bowel, and patients with regular cancers in the right side of the bowel. And the reason why we are both examining the precursor and the cancer by itself is because we know the microbiota has a strong and central role for how the adenoma develops into cancer, and in cancers, for how the microbiome is modulating the immune system inside the cancer. So attacking the microbiome is an efficient and a novel approach by giving it as a spray during colonoscopy, where we come up to the cancer and to the part of the bowel and spray this solution into the part of the bowel. In the cancer patients, where we treat with local antibiotics, the reason for giving antibiotics before surgery is actually a different approach, where we want to shift the immune environment inside the tumor by removing the bad bugs, so bacteria that we know are driving the malignant potential of the cancer, and we know are affecting the patient's own immune system not to see the cancer. So we think this as actually a groundbreaking approach where we can go in and change the constitution of the cancer in order for it to be more sensitive to other therapies, which may not be surgery, but which may be immune therapy. So trying to change the phenotype of the cancer in order for it to be more sensitive to immunotherapy. And this is something that is intriguing me a lot as both as a researcher and as a clinician, that we actually can try to change the way we're thinking treatment of these patients with right-sided cancers. What we see in the published literature so far, and these are large papers in big international journals, is that there are some specific bugs, some specific bacteria that are the most aggressive ones with respect of suppressing the immune system and pushing the cancer cells to disseminate. And actually it travels with the cancer cells to the liver or to other organs. These are, for example, Fusobacterium nucleatum. What we have shown in the treatment with antibiotics is that we can actually suppress the Fusobacterium nucleatum just by one single antibiotic treatment, 1 week to 10 days before surgery. And what we also can see by removing the bacteria, we can change the environment of the tumor and then increase the number of immune cells that are effectively killing cancer cells. So this is as a continuation of the results that has been proven internationally, that the bacteria is important. We are just showing how can we modulate that bacteria more specifically, so go in and kind of taking it out of the equation in the cancer. So until now we have shown that treating patients with this local antibiotic can both show strong indications that we are removing the biofilm that is important for adenoma generation. The next step here is to develop this concept into a clinical trial involving several centers and to demonstrate the actual prevention of new precursors to cancer. With respect of the cancer trial, we are in a phase where we see that we have some interesting, actually surprising results, that we both modify the immune system, we change the microbiota to both reducing this bad Fusobacterium nucleatum and increasing the good bacteria such as Bifidobacteria and Lactobacillus. So we are now at the same time seeing that we can also start an immune system. So the next steps will be to demonstrate whether adding an immunotherapeutic drug can actually be an effective way to start an immune reaction in those patients that has a cancer which is not sensitive to immunotherapy. So obviously, this is not a Danish phenomenon. This is an international phenomenon. And there's a global huge interest in solving this because it's a huge global healthcare challenge, both respect of the precursors to cancer and patients with colorectal cancer.